Just giving an update to those who have ordered the IFAK that we came up with for the 32nd FF. This is what 4 packages look like that I put together. You can see that they're a little bit bigger than the size of my palm. They got everything that was listed in there. There is only one caveat. I had to change out the 2 gauzes into 1 gauze because the order came in incorrectly. So it's 1 larger gauze, which is just fine either way. In this package right here, the contents laid out here nice and cleanly. Quick clot for a traumatic wound injury to pour in, fill it up, and help clot that blood, critical wounds. And we have 2 bandages. These are the H bandages. A large roll of gauze, which being a trauma kit, this kit will only be opened once. Once it's opened up, you use the gauze, cut off what you don't need, extra if you need it. This is a combat tourniquet that covers kind of your bleeding, tourniquet, gauze, quick clot, bandages. Also here for a little bit you have some gloves. These aren't sterile gloves, but they'll keep your hands from getting quite disgusting in the process of treating a wound. We got some little cloths here that'll help clean out the wound, sterilize some stuff there though, wipe out any gunk, dirt, whatnot, keep it as best as possible before we actually treat the wound. Nasal pharyngeal airway, or also known as an NPR. And this is your decompression needle for the tension pneumothorax. Also, we have a little roll of medical tape, and this will help keep any plastic down for a sucking chest wound, help treat that using the packaging from one of these things here, or maybe the outside packaging here altogether to apply that on a sucking chest wound. These packages here would fit into a kind of your standard Marine Corps IFAK kit. They have a lot of different similar size bags for it. I got plenty of extra room in here for other little goodies. As you can see, you can shove in your band-aids or whatever else that goes outside of your trauma kit. The second example here is I think this is a tactical tailor medical pouch. Basically, it'll fit into here. One second while I open this up. And then this pouch actually folds down in 2 sections, so I'll have the trauma kit up here, as well as another area up here to access kind of you know, your more minor stuff that you wouldn't want to crack open a trauma kit for. So these are kind of 2 pouches. You can pick whatever pouch you want, as long as it goes kind of on the same spot as the rest of the 32nd FF. So as long as it fits, which is pretty safe if it's kind of the Marine Corps pouch or kind of anything that's kind of labeled as a medical pouch. They make them big enough for the IFAKs, and this is pretty standard size IFAK. It might be just a little bit larger. We threw some extra goodies in there, but it still fits just the same. So anything else that you can't really fit in your little pouch, it's fine and dandy, because they're usually not critical things that we need to pull out right away, like when it's like a blowout. So that stuff can kind of go in your butt pack or maybe in your cargo pocket. We used to use a minor medical kit in our cargo pocket too. So that's kind of the update. These kits will be available for those at the FTX on Saturday, and anybody else who wishes to get one, just let me know and I can whip one up. I do have some extra supplies handy, so that's your update.